How much do the ADIR and ADOS cost? If you are curious about the costs associated with the Autism Diagnostic Interview-Revised and the Autism Diagnostic Observation Schedule, you are in the right place. Understanding these costs can help families prepare for the diagnostic process. First, let's talk about the Autism Diagnostic Interview-Revised. This assessment involves a structured interview with a parent or caregiver. It focuses on the child's developmental history and current behaviors in three main areas: language and communication, social interaction, and restricted or repetitive behaviors. The cost of the complete Autism Diagnostic Interview-Revised kit usually ranges from approximately $436 to $760. This kit includes essential materials like manuals and interview booklets. If you need additional materials, such as scoring forms or software, those can be purchased separately. Scoring forms typically cost around $34, while in limited-use scoring software can be over $460. Some providers also offer starter kits or digital versions, starting at about $660. The interview itself takes about 1.5 to 2.5 hours to complete and must be administered by a trained clinician. Now, let's move on to the Autism Diagnostic Observation Schedule. This assessment is a standardized observational tool where the clinician interacts directly with the individual suspected of having Autism Spectrum Disorder. The clinician observes social and communication behaviors during this interaction. While specific pricing details for the Autism Diagnostic Observation Schedule were not provided, the costs for the kits and materials are generally similar to those of the Autism Diagnostic Interview-Revised. You can expect prices to range from several $100s to over $1,000, depending on the module and materials included. The administration time for the Autism Diagnostic Observation Schedule varies by module but usually lasts between 30 to 60 minutes. Both assessments are often used together to provide a thorough diagnostic evaluation. They complement each other by assessing different aspects of autism-related behaviors. The costs mainly reflected the purchase of assessment kits and materials. Remember, there may be additional costs for clinician fees related to administration, scoring, and interpretation. These fees can vary widely based on the provider. Since both assessments requiring specialized training, only qualified professionals can administer them. Understanding the financial aspects of these assessments is important for families seeking accurate diagnosis and support. The investment in these tools is essential for effective treatment planning and educational support for individuals with Autism Spectrum Disorder.